So what we have in the back here is the lateral meniscus and the medial meniscus. You can see the little bit of inflammation here, meaning that she's injured, and maybe we don't have it, but the LCL and the MCL, maybe that's an injury for you as well. Now I have these two weights here to kind of demonstrate what happens when you're doing your squats and your lunges. Maybe your knees kind of cave in a little bit, they go this way, or they go out. So that was in and then out. Now, if you have a meniscus injury, a medial side of the meniscus injury, and your knee is going out when you're doing your squats, you have a lot of weight on the outside of your foot, you're going to be putting more pressure on the inside of the knee. Now, if your knees are collapsing inward, you're going to be putting more pressure on the outside of your knee, and you're going to be stretching out the ligament on the inside of the knee. So it goes out, pressure on the inside of the knee, stretching the ligament on the outside of the knee. I'm about to drop this weight on your foot. So what do? You focus on keeping your foot aligned with your knee. So the knee and the foot are moving together and keeping everything in line. So that when you're moving, you're keeping the weight distributed equally across side to side versus letting it kind of wobble around. Now, one other thing to note, the knee itself only has one muscle in it. It's not painted on here. It's called the popliteus. And it's actually going to be your hips and your foot that are going to stabilize and keep your knee in alignment when you are doing your squats and lunges. These guys, the glutes, the adductors, the arches of your feet, the lower leg muscles, all this stuff's going to make sure that your base is stable. The hip muscles are going to make sure that the knee stays in line. All of these guys are going to help extend and flex the knee, but they're not really going to spend too much of their time making sure that the knee is stable in or out. So keep your knee in alignment, keep the weight distributed equal from side to side. Have a good day.